So today, the tension between the Trump administration and Minnesota escalated once again as the federal government announced it's withholding another $199 million in Medicaid funding to our state because of concerns about fraud. Here's Danny.
And thank you for joining us today.
At a news conference Tuesday in D.C., Health and Human Services Secretary Robert F. Kennedy announced a pause in some Medicaid funding for two states, California and Minnesota.
If those states want that money, they need to provide documentation that these payments are legitimate.
In a letter to Minnesota, the federal government said it's withholding $199 million in Medicaid funding from the latest quarter to address issues that remained unresolved. This is the third time since February that the Trump administration has deferred Medicaid funding to Minnesota. The money in question is related to 14 high-risk Medicaid programs, which KARE 11 Investigates has reported on extensively, specifically in-home and personal care services.
We use traditional financial verification. We used AI, advanced analytics, and other cutting-edge tools to identify suspicious activity and potential fraud.
The Minnesota Department of Human Services questioned that narrative, saying the Trump administration hasn't provided any data or explained how it arrived at the $199 million deferral figure. Temporary DHS Commissioner John Connolly said, "Today's actions show that the federal government is acting again in unprecedented and punitive ways as part of their war on Medicaid and its recipients. Partnership, not politics, is required to stop criminals and protect services for the people who need them." Connolly testified at the Capitol earlier this month about the state's efforts to revalidate Medicaid providers, saying the Trump administration gave them only 5 months to review thousands of providers.
This was extraordinary. This was incredibly challenging for the providers.
During this process, Minnesota disenrolled more than 3,000 providers from Medicaid, largely because of paperwork issues, they said, not fraud.
Well, ultimately, the people who bear the consequences of funding disruptions really are not those committing fraud. They're the people with disabilities, older adults, children.
Tina Rucci is the public policy director at the ARC Minnesota, a nonprofit that supports people with disabilities.
We do understand concerns around Medicaid fraud and, of course, don't want to see any level of fraud in our Medicaid programs here in Minnesota, but it's starting to feel like rather than working collaboratively with states to strengthen oversight while protecting access to care, these ongoing deferrals and withholdings of Medicaid payments appear to prioritize punitive measures over partnership.
Danny Spiewak, KARE 11 News.
In total, the Trump administration has now deferred more than $500 million in Medicaid funding to the state of Minnesota. And Governor Walz today did not mince words. He called it a part of an ongoing campaign of retribution against the state of Minnesota.